A dedicated troupe of staff and volunteers at Calgary's Tom Baker Cancer Centre is bringing tidings of comfort and joy as they deck the halls with Christmas carols this holiday season. For 6 days leading up to Christmas, the traveling group will sing for patients and families in waiting areas, chemo and radiation treatment areas, and throughout the corridors of the centre.
So we started this last year in 2014 because I thought that we were not just a cancer center for chemo and radiation and blood scans and a battery of tests, but we are a patient-centered care where we focus on a bio-psycho-socio-spiritual model of care, where we treat individuals with dignity and respect and bring out the best in them, not just focus on a deficiency that they have. Plus also cancer is not a death sentence. They can take it that way, but there is so much life left in each of us that we want to honor each individual's with uniqueness.
Musical Conversations is an ongoing collaborative effort of spiritual care, healing arts, and volunteer resources. The purpose is to provide patients and families with musical enjoyment while they wait for appointments and treatment. Approximately 80 staff and volunteers participate, many on multiple occasions, using their breaks and lunch hours to come out and sing for patients and families.
I went and randomly asked staff if they would be willing to sing caroling for patients and families. Most of the people who I asked were really grateful that they were asked, and even though they are not professional singers, we are still professionals with fun and activity and commitment. So when we started with 1 or 2 people, and then little did we know, when we really started it, we had lots of people join us, almost 15, 20 at some point in time.
The first year that I worked here, I worked in the chemo room, and people would ask me, I started in November, and people would ask me if that was a sad place to work. And I remember the first year I worked here, a woman was getting chemo and she just started singing a Christmas song, and then the man beside her joined, and then all of a sudden the entire room joined in until the whole room of chemo patients was singing. It was beautiful. So my response was, it's not a sad place, it's a wonderful place.
It also brings people together because now they know people from different tumor groups, different disciplines, across different floors, and now they have made more friendships, and we recognize each other's talents not only in singing but also in the fun activity of instrumentals and singing together as a group, so it builds up teamwork.
Because sometimes, you know, you're busy with Christmas and you don't want to come here, and then it's nice to, you know, just be reminded, and the time goes by faster when that's going on. Yeah, and you forget about what's happening, and then you just focus on Christmas and the Christmas caroling.
I have seen so much of calm and a normalcy return, especially when they are waiting for their treatments. While in that waiting period, it brings calm and reduces some fears, brings some normalcy, and people know that we are human. We are not just machines who give chemo and radiation and those kind of things. We are humans with same kind of interests and values that they also have. And for me personally, Canada has been so good to me. So I would like to give back and make a positive impact on the place that I work with and for the people that I work for. So this is my way of bringing in the initiative during Christmas season and make maybe patients and families more joyful.